Imagine having a loved one that's in the hospital and you found out they weren't receiving care because there weren't enough nurses there to help. Or imagine you yourself are hurting, or maybe you become ill, or maybe you've even fallen, and you hit your call light and nurses are not responding. And you find out later after the fact that was because there weren't enough nurses on staff. Or imagine you yourself are a nurse and you've went into this profession because you want to be able to care for people. But unfortunately, you can't give these patients the care they need because there's just not enough staff there to help you out, and you have way too many patients on your hands. The sad reality is this is becoming very frequent here in the United States. A lot of people might be really quick to blame the nurse, but it's not always their fault. These nurses and nursing assistants are being overworked and being assigned dangerous number of patients to take care of at one time. Currently in the United States, only one state, one of 50 states, has laws on nurse to patient ratios, meaning 49 of these states, there is absolutely no limits on how many patients can be assigned to one nurse. How terrifying is that? Nurses and nursing assistants are showing signs of burnout, mental exhaustion, high stress levels, and unfortunately, these are leading to mistakes and accidents on patients. According to a study done by Marshall University, burnout has dramatically gone up over the last few years. It's gone up by a staggeringly 60 to 70%. In 2017, there were 2,540 reported incidents from nurses alone who had illnesses or injuries related to burnout or exhaustion that required time off. In that same year, 34,210 incidents were reported by nursing assistants. This has affected the outcomes of patients. Outcomes in patients could be things like death, injury, infection, medication errors, and many, many more harmful things. According to the Department of Professional Employees, a study has proven that there is a 7% increase in the risk of death of patients within the first 30 days of their admission due to this burnout. In 2006, a study showed that patients were 16% lower survival rates in hospitals in which there were poor nursing environments, with an additional increase of 5% if that patient had one additional one additional patient. And for every additional patient after that, it continued to go up by 5% more. A study was performed in 2012 that proved simply by just having stricter rules and laws on nurse to patient ratios, there would be decreased infections from possibly 30% to an impressive 10%. As mentioned before, California is the only one that has a law that governs this. Their law went into effect in 2004. Their implementation includes the following: one nurse to one patient for OR or trauma, one nurse to for two patients for ICU, NICU, post anesthesia recovery, and labor and delivery. Next, they have a one nurse to three patients for step down units, one nurse to four patients for antepartum, postpartum, pediatric, emergency room, telemetry, or other specialty cares. There is a one nurse to five patients for medical surgical units. And there is a one nurse to six patients in psychiatric and postpartum women only care. According to the U.S. Bureau of Labor Statistics, there was a collection of data done on a surgery of illness and injuries, which includes information on roughly about 200,000 firms. They believe that there would have been 55.57 fewer injuries or illnesses for every 10,000 nurses in 1 year. According to the National Nurses United, there was another study completed in 2013 in which found that there was a decrease of 9% in ICU patient deaths and a 16% in surgical patient deaths and a 6% decrease in medical patient death overall. That's approximately 60,000 adverse patient outcomes that were avoided strictly by having this implementation of rules and laws. A nurse's job is to care for patients, and the lack of these kind of laws make it so unsafe. 49 states are putting these risks on these nurses and these patients. If a patient was to code, which means that they stop breathing and their heart stops, and maybe CPR was needed to be performed, this can become a very dangerous situation if the facility is already understaffed. Imagine if you had two patients that started coding, which was completely possible in some of these hospitals. How do you decide which one you're going to go to first? You can't be two places at once. Patients are suffering because of these shortages, and their lives are being risked. These are completely preventable deaths that should not be happening because of lack of laws protecting them. The nurses and nursing assistants that put their own needs and wants before themselves should not have to risk burnout because of lack of laws protecting them. California's laws are a good starting point for medical facilities, but medical facilities also need to advocate for their staff and their patients safety by implementing case-by-case situations. A nurse who has two or more patients with a lot of issues going on a med-surg unit should not be given more than those patients alone, because she puts them at risk of not being able to care for them properly. It is imperative that we make some kind of change. We must stand up for our rights to have adequate health care here in the United States. We must reach out to the people who can set these laws into motion. So you're probably asking, what does this have to do with me? I'm not a nurse and I don't even work in healthcare, possibly. Well, the thing is, though, think about it. It could be you one day as that patient. So you can get involved. And here's how you, at least here in Kentucky, can get involved. Here's some people you can write out to. You can reach out by talking to the Kentucky Board of Nursing. You have two options. You can write them. Their address is 312 Whittington Parkway, Suite 300, Louisville, Kentucky 40222. Or you can visit their website at www.kbn.ky.gov. Or you can reach out to the governor here in the United States, Andy Beshear, by calling 502 502. I'm sorry, let me start again. It is 502 564 2611. Again, let me repeat that for you since there was a little bit of mess up. 502 564 2611. Or you can write through their website at www.governor.ky.gov/contact. Again, that is governor.ky.gov/contact. In Kentucky, we currently have no laws. So you know what that means? We're not protected. Who's going to protect us if we don't make these laws? We have to be the voice of change for these nurse to patient ratio laws. Do your part. Because you know what? That may save your life or your loved one's life one day.